Well, over the past several years, we have had millions of people get health insurance who didn't have it previously. Some through the health insurance exchanges, so they're in private insurance plans, and a lot of people through the Medicaid programs of the states that have expanded it. That increase in people who have access to insurance means that there are a lot of people who are in a position to seek primary care and preventative services who didn't have the finances to do it before. But in order to meet their primary care needs, we have to have a sufficient workforce to do it. I think now people are becoming more aware of that. They're recognizing that healthcare is not delivered by robots, it's delivered by people who form that workforce. They behave in certain ways, they have various incentives that they face in deciding their careers, and the research of a workforce center like that of CHWS can help inform what we need to do to make sure that our workforce can meet the demands of the healthcare system. The Center for Health Workforce Studies has been a leader in both national and state level health workforce research. I would view them as one of the first organizations that were in that area of work, primarily starting with national research, but their work in New York State has been incredibly in-depth. The center's research covers both describing the workforce as well as research that I would describe as much more formative. And what I mean by that is it is forming theories and testing theories that understand how the workforce behaves. So it's not just enough to count people, which the center does incredibly well, but they also have done some really groundbreaking research on how the workforce is behaving. Or, for example, Jean Moore's recent study of looking at racial and ethnic differences in wages got into the question of, well, how much of this is coming from where they work, their education levels, differences in where they're coming from. And she was really able to drill down into the data at a much deeper level and find that there was still this gap in wages that we don't fully understand that maybe is even suggestive of discrimination. And so that goes beyond just counting the people and really beginning to describe workforce behaviors and trends that are important for us to think about from a policy standpoint.